Dave here. What is plantar fasciitis? Well, leading up to the 2012 Ironman in New York City, I developed plantar fasciitis. Now, granted, I live in New York City and my training grounds were constantly on pavement most of the time, so I rarely ran on the grass or on the dirt. But I developed plantar fasciitis because of the overtraining mixed with a lower heel to toe ratio sneaker, more of a racing type of sneaker, which I'll talk about in my blog and other videos. But the plantar fascia is this thin sheath here on the bottom of the foot. And it's a broad sheath that crosses across all the toes here and comes across to one point here right on the heel, okay? And oftentimes it presents as pain, soreness, feels like a bruise sometimes in the morning, or tightness on the bottom of the foot. And it can also be around the heel as well and in the middle of the foot. Usually worse in the morning when you first get up or after you've been sitting for a while, and sometimes it loosens up and feels a little bit better unless it's a severe case. Now, when the plantar fascia gets inflamed, it becomes plantar fasciitis. So it's just a fancy word for saying inflammation of the plantar fascia. So why do we get plantar fasciitis? Well, it's a few things that can cause it. First and most common is overpronating the foot, so flattening your foot out, okay? It's important to know though, you don't just have one arch in your foot, you have three arches in your feet, okay? You have your plantar arch, which goes right across, right at the bottom of the toes there, across it, the plantar or the transverse arch, and then on the inside of the foot you have your medial arch, and then on the outside of the foot you have the lateral arch. So we have a machine, a laser, that reads all three arches. Same type of laser you would cut precision tools with. It's very accurate, and the beauty of it is it cuts the perfect pair of orthotics, and they even give you a money-back guarantee. So important to understand which of the three arches are collapsed or flattening or pronating. And beyond that, the other causes of plantar fasciitis would be what I mentioned before: overtraining, constantly I was putting 40 to 50 miles on my feet a week while training leading up to the Ironman. So, and then the third thing could be unlevel pelvis or severe chronic sciatica due to usually a disc herniation of some sort, or a disc bulge or stenosis. And that can cause the weakening of the nerves that run down from the lower back and control a muscle in the shin region that controls your medial arch. It's a concentric muscle and it forms your medial arch. And if you have nerve damage, then that can cause flat-footedness on one side and a perfectly fine foot on the other side. And again, with our 3D laser scan, we'll be able to pick that up right away. If you have any questions or comments about plantar fasciitis, feel free to comment below or check out our other videos on YouTube. Thanks.